Welcome to today's lesson on non-communicable diseases, where we will explore how various factors interact to cause conditions such as cardiovascular diseases, many forms of cancer, lung and liver diseases, and other diseases influenced by nutrition. In our lesson today, we will begin by describing how a range of non-communicable diseases are influenced by a complex interplay of multiple factors. We will then explore the effects of lifestyle factors like diet, exercise, and smoking on these diseases. Finally, we will examine and evaluate several case studies and examples of non-communicable diseases. So far, you have gained an understanding of the structure and functions of the digestive, breathing, and circulatory systems. You also know that cancer results from uncontrolled cell division. This knowledge will help you understand how these complex systems and processes can be affected by various risk factors, leading to non-communicable diseases. Knowledge of non-communicable diseases underscores the importance of different approaches in both prevention and treatment of these diseases, integrating public health strategies, lifestyle choices, and medical interventions. Let's get started. Non-communicable diseases are medical conditions that are not caused by infectious agents and cannot be transmitted from one person to another. They are usually chronic, meaning they persist for a long time and may get worse over time. Some common types of non-communicable diseases include cardiovascular diseases. These affect the heart and blood vessels and include conditions like heart attacks and strokes. Cancer, a group of diseases characterized by the uncontrolled growth and spread of abnormal cells. Lung diseases, conditions like chronic obstructive pulmonary disease and lung cancer. Liver diseases. These include conditions like cirrhosis and liver cancer, often caused by excessive alcohol consumption. Obesity and malnutrition, conditions related to poor diet and exercise habits, affecting body weight and overall health. Risk factors are characteristics or behaviors that increase the likelihood of developing a disease. For non-communicable diseases, these risks can be broken down into three main categories. The first category surrounds lifestyle choices. Excessive intake of alcohol can lead to liver diseases and is also a risk factor for cardiovascular diseases and certain cancers. Poor dietary habits, like consuming too much sugar or fats, can result in obesity, malnutrition, and an increased risk of cardiovascular diseases. Physical inactivity is a significant risk factor for obesity, cardiovascular diseases, and type 2 diabetes. The use of harmful substances like smoking tobacco can lead to lung diseases and cardiovascular issues. The second category surrounds environmental exposure. Air pollution can exacerbate lung diseases like asthma and COPD. Exposure to asbestos fibers can cause lung cancer and other respiratory diseases. Next, we have the unavoidable factors. The risk of many non-communicable diseases, such as cardiovascular diseases and cancer, increases with age. Some diseases, like certain types of cancer, have different prevalence rates between men and women. A family history of diseases can increase an individual's risk of developing similar conditions. It's important to understand that these risk factors often interact with each other, and it is the combination of these factors that influences the likelihood of developing a non-communicable disease. For example, an individual who smokes, consumes a poor diet, and does not exercise is at a significantly higher risk of developing cardiovascular disease compared to an individual who only has one of these risk factors. Similarly, certain risk factors are linked to multiple diseases. For example, smoking is a risk factor for both cardiovascular disease and cancer. When individuals consume more calories than they burn, they can become overweight or obese. Obesity significantly increases the risk of developing type 2 diabetes and cardiovascular diseases. Policies like the sugar tax aim to reduce the prevalence of obesity by discouraging the consumption of high sugar products. Malnutrition occurs when individuals consume fewer calories than they burn or have an unbalanced diet. The specific health impact depends on the nutrient lacking. For instance, insufficient intake of calcium can lead to brittle bones, and iron deficiency can cause anemia. Malnutrition is often a significant issue in developing countries where access to a variety of nutrients is limited. Body mass index, BMI, is commonly used to assess whether an individual is underweight, normal weight, overweight, or obese. Excessive alcohol consumption is a major risk factor for liver diseases. Prolonged and excessive alcohol intake can lead to liver failure and liver cancer. High alcohol intake also impairs the body's ability to absorb essential vitamins, leading to other health problems. Public health recommendations and policies, such as guidelines on responsible drinking, are designed to inform people of the risks and encourage healthier choices. Smoking is one of the leading causes of lung diseases, including COPD, pneumonia, and lung cancer. Harmful chemicals in cigarette smoke, including tar and nicotine, damage the lungs and airways. Tar can lead to lung cancer, while nicotine contributes to the thickening or hardening of the arteries and high blood pressure by causing plaque buildup in the arteries. To combat these health risks, many countries have implemented strategies like high taxes on tobacco products, generic packaging with health warnings, and advertising bans to reduce smoking rates nationally. Cardiovascular diseases can result from a combination of factors, including smoking, poor diet, lack of exercise, and excessive alcohol consumption. Chemicals in cigarette smoke damage arteries, causing them to thicken or harden. This issue is worsened by a diet high in saturated fats and cholesterol, leading to plaque formation. These combined effects result in high blood pressure and increased blood clot risk, potentially causing heart attacks or strokes. Risk factors that increase the likelihood of non-communicable diseases not only affect the health of the person who is affected, but also affects communities on a wider scale. Local areas with high rates of certain non-communicable diseases due to lifestyle norms such as poor diets or high alcohol intake can put a strain on local medical recourses, and more people require treatment. Risk factors can also affect the wider scale economy due to the costs of treating and preventing non-communicable diseases. People suffering from these diseases may also be unable to work, which lowers the workforce contributing to the economy. On an international scale, high rates of non-communicable diseases can hinder a country's development. For example, in developing countries, high rates of malnutrition can reduce the productivity of its workforce. Let's work through a question to consolidate our knowledge on non-communicable diseases and lifestyle factors. A 45-year-old man has a high BMI, smokes regularly, and consumes a high-fat diet. What non-communicable diseases is he at increased risk of developing? First, we can recognize key risk factors. The man has a high BMI, smokes regularly, and consumes a high-fat diet. Next, identify diseases linked to these factors. High BMI is associated with cardiovascular diseases, type 2 diabetes, and certain cancers. Smoking is a major risk factor for lung diseases, including lung cancer and cardiovascular diseases. A high-fat diet is linked to cardiovascular diseases and certain cancers. Therefore, the man is at increased risk of developing cardiovascular diseases, lung diseases, and specific cancers. In today's lesson, we examined the various contributing factors to non-communicable diseases, focusing on cardiovascular diseases, various forms of cancer, some lung and liver diseases, and diseases influenced by nutrition. We discussed how these conditions arise not from single causes, but rather from the interaction of multiple factors, such as genetics, lifestyle choices, and environmental influences. We looked at how lifestyle factors, including poor diet, lack of physical activity, smoking, and excessive alcohol consumption, significantly increase the risk of developing non-communicable diseases. Additionally, we analyzed how obesity, high blood pressure, and high cholesterol levels can lead to cardiovascular diseases, and how long-term exposure to environmental pollutants can contribute to lung diseases. Moreover, we considered the role nutrition plays, understanding that certain diets such as those high in fats can predispose individuals to various health issues. We also discussed how certain cancers are linked to lifestyle choices and environmental exposures. Finally, we looked at some more in-depth case studies and example of non-communicable diseases, as well as some treatments and preventative methods. By understanding the factors that contribute to non-communicable diseases and the ways lifestyle choices impact our health, you can develop an understanding that will aid in both personal and broader public health considerations. This knowledge is important for developing effective prevention and treatment strategies for these prevalent and often preventable diseases.